morning, everybody. Good morning, everybody. My name is Linda Connolly, and I'm a professor of sociology at Maynooth University and director of the Maynooth University Social Sciences Institute, which is hosting this seminar conference this morning in collaboration with the Department of Sociology. I'm delighted to welcome you all here. The title of today's session is Leaving No One Behind in a Pandemic Recovery, Enabling Employment Services Through Governance, Collaboration and Co-Production. And this event is organised by my colleague, who's a principal investigator in the Institute, Professor Mary Murphy, and I want to thank Mary for all her work in organising this event, and also my colleagues Dr. Nuala Whelan and Dr. Michael McGann as well. So thank you for organising this important session, as I said, on enabling employment services in a post, I suppose, pandemic context. And I use that word post-pandemic deliberately because I do think it's important we do start trying to look beyond the pandemic, and I think this discussion this morning will do this in a really effective and thorough way. I'm just going to remind everybody of the theme and the focus this morning. The 2020 COVID-19 pandemic, as we know, followed a very particular period of economic history, really, in Ireland after the 2008 financial crisis and the related 85 billion European Troika bailout of Ireland in 2010. And I suppose that really reading the description of this event, it really, I suppose, suggests we barely recovered from the last bust, from boom to bust, and now we're into a situation of having to deal with the aftermath of a global pandemic that has had an uneven and unequal impact, not just in Irish society, but across all societies. And this has, we have seen the kind of known inequalities and issues in society around that becoming exacerbated. Issues like education, health, employment, children and young people, mental health, etc. The cuts from the previous bust, the previous period of austerity that followed, had direct impacts on policy capacity, in particular, of some sectors in society, including engendered interests. And again, we saw this during the pandemic, the way in which, I suppose, any progress made in terms of women and citizens who are balancing caring duties with employment, again, I use that word, became exacerbated when a pandemic occurred. So gendered interests, poorer communities, again, we see, if we look at the data on COVID, there's an inequality there. Poorer communities being greater impacted by COVID. And those delivering social services, again, it has been very difficult to access very basic services for many people who are quite simply in dire need of them in some cases. So a decade later, austerity has had severe effects, particularly deepening the public sector fault lines exposed during the pandemic. What we might call social disinvestment has exacerbated the underlying social conditions so that the pandemic is experienced unequally by groups of people of different class, ethnicity, gender, and generation. We also are witnessing at the moment a very vibrant debate about housing and housing inequality, which again is something that really hasn't been resolved in that period of austerity that Mary and colleagues are referring to here. However, on the plus, and what I'm really looking forward to listening here this morning is less has been said about how austerity has eroded the quality of local and social analysis that is available to policymakers and how it has impacted who influences government's pandemic responses. And I know very much in the social sciences in Maynooth, and I know my colleagues involved in this conference and the contributors who I'm also pleased to welcome, and Mary is going to introduce them in a minute, but I know we are very, very strong on our work, our research being of relevance, of policy relevance, but also of, I suppose, feeding into the policy process. So I think this event is very timely. I think it's very important, and I want to wish you all the best of luck this morning, and to thank you for organising it, and also to thank my colleagues in the background, who I'm sure Mary will mention as well, for their work in organising all these online events. So I'm going to hand over now to Professor Mary Murphy, who's going to introduce the next session. Thank you, Mary.
Thank you, Linda, and indeed thanks to MUSSI and particularly to Orla and Anne for the background work they're doing today. I wanted to start just by outlining very quickly the rationale for the conference. This is our third conference, and we've brought together the work that we're doing that's funded by the Irish Research Council, a collaborative approach to public employment services, with work that's funded by Horizon 2020 under Michael McGann's guidance, governance and activation in Ireland. So this is our output, if you like, from those two projects that have been going on over the last 2 years. And a lot of it is focused on the idea of inclusive employment and trying to promote the sustainable development goal of an inclusive labour market, and particularly looking at public employment services from that perspective. So what we're doing today is speaking to a very broad audience. There's over 250 people registered, and we're very, very pleased that, as well as academics, both national and international, we have a very wide range of people. And I'd like to welcome particularly politicians, both TDs and senators, who are present in the call, policymakers, practitioners and claimants. And to thank everybody for coming, because I think it is a really important accumulation of work that we have done. And we have brought together both national and international actors who we've collaborated with over the last couple of years. And the format is 4 integrated sessions that includes 2 launches. And we wanted to start, I think hope is a political position, and it's very easy to get grinded down by the day-to-day reality of this. So we wanted to start with optimism and with hope, and with 2 examples of what we consider to be international best practice in thinking about enabling employment services and working with people more distant from the labour market. So we have examples from Scotland and Denmark. To begin our conversation, sometimes we might end with those kind of examples, but we thought really to perk people up to begin with, that things could be going in a particular direction. We then want to maybe sober things up a little with Michael McGann and I introducing some of the work we've done, contextualising what's been happening in Ireland from the perspective of institution building and governance of public employment services. Then we'll move on to the first of our launches, which will be Nuala Whelan's work, a model for enabling employment services, a toolkit which we hope will be of significant use in the future in enabling good, positive, inclusive public employment services. And there'll be some responses from some of our advisory committee members, both national and international, to that. And we'll end with a launch of a special edition of Administration, which is examining the last decade of what we call the activation turn in Ireland. And we'll have a couple of responses to 4 articles that are in that special edition. So we've packed the day, it's very busy, and I don't want to stay on any longer other than to say welcome again. Thank you again to everybody, to funders, to participants, to our advisory committees, to you, the audience, to MUSSI, and particularly to Michael and Nuala, who have been extremely good colleagues. We'll get to say this again at the end, but sometimes there isn't time, so just important to say it now. So without further ado, I'll hand over to Michel Bonvin, who is in the University of Geneva and who will chair the first session. Thank you, Michel.
Thank you, Mary. So I'm very pleased and honored to have the opportunity to chair this important session. The title of the conference is Leaving No One Behind. So it's an issue of inclusion, a logic of inclusion, but it also matters to know where people will be included, inclusion into what. And I think the notion of employability may entail some ambiguities in this respect, which means that it may be inclusion into any kind of work. So work that may be not valuable in the eyes of the main beneficiaries, and it may also be exclusive of other kinds of potentially socially useful contributions. So I think the focus on the issue of the capability approach may allow going beyond these ambiguities of the notion of employability, because it points to the necessity of proposing inclusion into valuable work and opening the opportunity to be included into socially useful contributions for society. So not only work, not any kind of work, and not only work could be envisaged as solutions in terms of inclusion, in terms of leaving no one behind, and specifically for the most vulnerable people. So there is a kind of, let's say, a precision, an emphasis of the capability approach that is quite important, and that allows going beyond the ambiguities of the notion of employability. Maybe 3 dimensions are important to be integrated and to be taken into account for this. I mean, the first one is the issue of the co-constructions of the programs and interventions, to take into account, to pay due attention to the voices and aspirations of the main people, the people concerned, the most vulnerable people, in order to construct the program with them. This is also the focus on the collaborative view of employability that is really at the core of the capability approach. So the first one is this issue of co-construction, and how can voices and aspirations of people be taken into account when programs and interventions are designed for them. And then the second one is the issue of the temporality. I think that for long-term, for vulnerable people, it is especially important to have a long-term perspective. If short-term results or outcomes are aimed at, are targeted, that may mean that the solutions will not be completely adequate or adjusted to the needs or to the aspirations of these vulnerable people. So how is this long-term perspective taken into account when employability policies, or when policies for most very vulnerable people are designed? And the last one is that maybe this is something that is related to the transitional labor market approach, is that it's not only an issue of equipping individuals for the markets or for employment or labor markets, it's also an issue of equipping markets, or equipping or creating valuable jobs, or contributing to create valuable jobs or valuable opportunities for professional inclusion, or for being socially useful for these people. And also it means that it has to be, the focus has to be not only on individuals, but also on economic context, labor markets, and social context, in order to create valuable inclusion and leaving no one behind, being in terms of being valuably included, and not only being included in any kind of activities or any kind of job. So now we have today three very excellent speakers that will allow to tackle these issues and try to see how employability policies have been designed, or some experiments have been designed in Denmark and in Scotland, in order to reach this idea of a valuable inclusion. So the first team of speakers will be about Flemming, Larsen, and Dorte, Caswell, and they are both based in the University of Aalborg in Denmark. I don't know if the pronunciation is right, certainly it is not. Flemming is a specialist in labor market and social policy, both from a political science and public administration perspective. And he has worked a lot on the issue of flexicurity and transitional labor markets. And Dorte, Caswell, is an associate professor at the Department of Sociology and Social Work in Aalborg University, Denmark. She's also the head of a research group that is investigating the issue of social work at the front line of active labor market and social policy. And the two of them will have a presentation, a 15-minute presentation on the issue, the lessons that we can learn from Denmark on the issue of co-creation and employment services. And then we will have a 15-minute presentation by Colin Lindsay, who is Deputy Director of the Scottish Centre for the Employment Research at the University of Strathclyde in Scotland. He is a very well-known expert about issues of employability, skills, public management, and social policy. And he will talk to us about lessons from Scotland this time, and about the issue of collaborative approaches and employability services. So I will not speak any longer, and I will leave the floor to Flemming and Dorte for the first presentation. Thank you very much.
Thank you. I'll start sharing my screen. And thank you for the invitation to come here. No one told us that we were supposed to bring hope to Ireland, but hopefully we can come up with at least some ideas of how to design the public employment services. So it should work now. So this is the title for our presentation, how to make co-creation in an era of welfare conditionality. And we'll try to tell a bit about the experiments we have been doing in Denmark in this respect. But let's start about what we mean about an era of welfare conditionality. We have a very good Dutch colleague, Rick van Berkel. He talked about what had happened the last 2 decades is a kind of triple activation. It's not only the unemployed that must be activated, it's also the frontline workers and in the organization in which the frontline workers work. So that's what we've been seeing, that not only we're trying to discipline the citizens and the unemployed, but we also try to discipline the system that work with them. But there are some kind of, you can say, inherent problems and dilemmas in this approach. It becomes very much standardized. It's of course also a part of new public management, but this kind of triple activation means that there's less flexibility in service, and it comes up a lot of criticisms of what you could call of meaningless services, was all about meeting targets and follow procedures. But there are not many suggestions for what should be alternatives. And we've seen there's this huge project in the UK where they've tried to document what happens under the welfare conditionality project. And they can document all the, you can say, perverse effects about this approach, but there's not so many suggestions about what else to do. At the same time, I think this approach has also resulted in that the employment services become very, very criticized. I think they may be the most criticized public services in the world, and that's also been happening in Denmark. I think there's a huge political consensus from different type of political parties that the job centers, they should deliver more respectful and meaningful services. But at the same time, no proposals about how to do this, because at the same time, they will of course have this continuous focus that people should actually be focusing on getting into employment. It should be effective, and we should be sure that no one is cheating. There's also this, at the same time, we have seen that this approach not only have been for people who become just, you can say, when the people get unemployed, we need to have some kind of disciplining aspects in the services. But we've also seen this expansion of the target group. So people who would normally be, you see, in the target group for social policy measures suddenly become part of the job centers services. And this creates a lot of challenges. And I think that we could also see there's a lack of effectiveness because they can't really respond to these incentives of getting into work and the conditionality approach. So we see that there's this problem with these vulnerable citizens also about the need for more flexible services. And then there come up some kind of false contradiction, I think, that have emerged from this welfare conditionality approach, at least in Denmark. But there's this kind of idea that you can't really both have demands and focus on employment at the same time as the unemployed are involved in and heard in relation to what creates value for them. So that's what we're working with, is how can you actually change this focus so that you also somehow can combine that people are not cheating, we are still having a focus on employment, but at the same time, it actually also create values for the people who are the target for the policies. I think that's also a way to increase the effectiveness of the services. So that's why we work with co-creation as a part of services. And we see actually, I think there is an open window for this at the moment. We see this wave with a lot of talk about co-creation, individualized services, user involvement, etc. As a response to create the more effective, fair, and responsive and respectful employment services. And we are also very occupied with what Stephen Osborne has said, is a kind of move from having this focus on what creates value for the public services to what create value for the citizens. So he has this kind of definitions that we have to move from this you could say production mode where you have the logic is linear and based on a kind of product dominant conception, and moving towards a more interactive and dynamic relationship where we have this focus on creating value in the interaction. And this is also, of course, a part of the much larger discussion about actually moving from new public management to what some people label as a new public governance. But how do the public service organization or private providers doing the services look in this perspective? And what we can see now is that, this system we have made up is very based on mistrust. It's based in mistrust in the citizens, based in mistrust in the frontline workers, based on mistrust to the system itself. So maybe we should move from this triple activation to kind of a triple trust if we really want to make a kind of a turnaround. And that's what we have been working with. We have been doing some experiments now. We have actually funding for an 8-year project, which is really, really rare into our world that we have such a long-term project period. But we're trying to make innovation in public service, exactly trying to see how can we promote co-creation in services? How can we make user involvement? And we had these two projects, very, very closely cooperation with different municipalities in Denmark. And I should mention that the public employment services are fully municipalized in Denmark. So we had a lot of amount of data. I'll not go into this, but maybe say that we have a very, very close relationship to the job centers and the system in itself. And we have had full and open access to practice in all of these participating municipalities. And what we have discovered in these experiments about making co-creation is that it's not possible to make co-creation as a kind of single projects. If you really want to make innovation into this system, you need to think it as a systemic thing. So you need to have system innovation. So that's why we actually work with everything at the same time, because you can't just say that, well, the frontline worker now, you should see if you can make more user involvement, if you're not somehow at the same time change the condition under which they work, just to take one example, or if you don't have the kind of cooperation with the employer side, et cetera, et cetera. So we work with these 5 pillars at the same time and try to develop new ways of thinking and working to create more co-creation into the services. And Dorte will now say a bit more about how we actually have done this, but because this is also something to do what is the base of knowledge for making these organizational change or system changes. So I'll hand the word over to Dorte.
Yes, thank you. My name is Dorte Caswell, and I'm a professor in social work. And this big project that we've been working on for such a long time, something occurred along the way, and this is what we call the 6th potential, which is how is practice gaining new knowledge and gaining use from research-based knowledge. And we lean on a quite a big tradition on sort of evidence-based practice, also strong in the UK. And the more recent development there is termed knowledge mobilization. So we draw this idea of knowledge mobilization into the collaboration between the researchers at Aalborg University and then the municipalities that we work with. So the idea is that we have to move from mainly this idea of knowledge transfer, that the researchers produce a specific kind of knowledge of what works, and then this has to be implemented. So the idea in knowledge transfer is that knowledge is moved from the producer of knowledge to the consumer of knowledge. And in this way, knowledge is seen as an object that can be transferred from one place to another. And the problem in this perspective is that knowledge has a lack, practice has a lack of knowledge. And the different approach to this is this idea of knowledge mobilization. And in the literature, there's a distinction between the concept of knowledge and then the concept of knowing. And this idea of mobilizing knowledge also recognizes that there's a lot of knowledge already in the practice area. So the practitioner and also very much the citizens themselves have knowledge. So it's not a blank page that you have to write on. It needs to mobilize. New knowledge needs to mobilize along with what is known beforehand. So in this knowledge mobilization, the idea is the problem is that there's a lack of knowledge exchange, and that sort of poses a new challenge to bring together knowledge creators and knowledge consumers to interact, also to figure out new problems that we need new knowledge on. So rather than sort of the top-down handing over knowledge, it's an ongoing exchange of knowledge and this idea of linkage and exchange. And this challenges the way we normally use to work with research. Will you change to the next one, Flemming?
I'm trying to, but I can't for some reason. Oh, yeah, well, here.
Oh. Yes. So in our current work, we have this idea of creating a dialogical knowledge production between research and practitioners. And with practitioners, we mean both the managerial level, but also the frontline workers. And one of the things that we are working with is the idea of knowledge not being coming up with specific solutions that then has to be implemented, but research also as something that disturbs the perspectives and the mindset of practitioners. So this could be, for instance, a new research analysis that comes up with a specific conceptual development that can be brought back to the practitioners, and this perspective can sort of push the way the practitioners look at their own practice, and in that way change and enable new ways of making better and more citizen involving practices in the employment services. It's a very important point here that we can't quick fix the employment services from research. So we need to build these dialogical knowledge production sessions in a way that we can push this sort of predominant public service dominant logic, which is this very strong production oriented logic in the municipalities, and then towards this idea of value creation. And it's a very long-term investment, both for research, but also for the practices engaged in it, that need to be willing to invest in this sort of long-term change. And one of the ways in which we've been doing this is this continuous use of what we call learning platforms, where the researchers engage with managers, engage with staff, and engage with users in a way, an attempt to make these sort of dialogues between research and practice. And this is sort of the illustration of what we've been doing and how we are doing it. So we create these learning platforms, and we do these learning platforms on each of these pillars that Flemming just briefly touched upon in his final slide. So we would have, for instance, a lot of learning platforms on the meeting between the frontline workers and the clients. And we'll draw in research from conversation analysis, for instance, and we'll do analysis of actual occurring interactions in the practice and analyze data with practitioners, and in that way we enable the practitioners to discover new ways of making more citizen involving practices in their day-to-day practice. So finally, just to sum up some of the points that we have discovered along the way. So one point I think very important is that we need to go away from this idea of single interventions and only focusing on these particular measures that work in an evidence-based sort of way, and into understanding research to be influential towards broader political and organizational context and the system innovation perspective. And we are working with these 5 different potentials that are these 5 columns that Flemming was showing, as a framework for both tactical, strategic and operational thinking in the municipalities. So the potentials are something we work with in our research analysis, but it's also something that the municipalities work for their way of developing their practice and their way of managing the practice as well. It's also another point that we need to understand that these sort of quite radical changes are dependent on context. They're not linear, and they cannot be copied from one context to another. So we need to understand knowledge mobilization as something that takes place within the organization, and research is able to assist this, but we cannot solve it. We need to have the practice solve it, and using research-based knowledge to do this. And then, as I've mentioned, this idea of dialogical knowledge production as a different way to understanding knowledge. And maybe just to one of the experiences we have along the way is that there's a lot of hunger for this knowledge. So rather than the sort of resistance that we sometimes see in practice from having new knowledge put down on them from above, we see in this dialogical knowledge production a huge hunger for getting this new knowledge and using it. So it's a different idea of implementing knowledge. And last but not least, we need to understand that this, in order to do this change, we need active participation and involvement, not only from the frontline workers and the managers, but also from the citizens in the way we design and implement new and better employment services. So that would be our sort of conclusion to some of the discoveries that we found along this very long process that we are in at the moment.
Thank you very much, Dorte and Flemming. So we move immediately to Colin.
Okay, hopefully colleagues can see my screen.
That's perfect, thanks.
Great. Good morning, everyone. My name is Colin Lindsay. I'm from the University of Strathclyde. Thanks so much for the invitation to speak. Thanks for the warm introduction from Jean-Michel. One of the things that Jean-Michel did not mention in my CV is that 25 years ago, I spent a semester studying my master's degree at Maynooth. And my memories, my big takeaways from that period a long time ago were, first, that I learned a lot from fantastic people like Seamus O'Canada and other great colleagues at Maynooth, and secondly that it was just a very happy and productive few months in my young academic career. So I'm always delighted to re-engage with colleagues at Maynooth. So I'm going to say some slightly depressing things to begin with, and then some hopeful and positive things about some research that we have been conducting on what we call collaborative innovation in employment and employability services. So the structure, here's the depressing bit. The depressing bit begins with lessons from the UK, I guess what you might call an exemplar liberal activation or employability state. And I guess my main argument might be that the general lesson to take from much of what the UK has done over the last 25 years or so is how not to do it. So I'm going to say some kind of depressing things about the mainstream activation agenda in the UK, but then I'm going to say, look, there's signs of life, because I want to report on some what we think are really innovative and exciting collaborative projects that are rooted in the values of co-production and collaboration in employability services at the local level. That's based on research that we did on employability services for lone parents, and then I want to get to a conclusion about hopes for the future at the end of that. Okay, so let's talk very briefly about the general context in the UK. I think the big takeaways from a lot of what happens in the UK is how not to do it. Maybe one way to think about how the UK has addressed employability over the last few years is, sorry to plug some ancient work of mine, but maybe a misunderstanding of the complex interactions that take place in people's employability journey. So about 1 million years ago, colleagues and I wrote a paper that basically said, if you think about employability, if you think about why some people experience disadvantage in the labour market, it's probably a complex interaction of those people's individual assets, so that might be their skills, their previous work experience, crucially, their personal circumstances. I'm sitting in the city of Glasgow where more than 10% of people are on disability benefits. So health, disability, caring roles, the complex personal circumstances that people face. And then labour markets in the workplace are also crucial, because labour markets define the opportunities that are available to people in work. So I think that still works pretty well as a way of thinking about what's going on in terms of people's employability. In terms of what you actually find in the UK policy context, there isn't much of a read across to that diagnosis of the problem and the evidence that we have on that, to how the UK does activation, which is really rooted in conditionality and, I'd said, extensive sanctioning. Sanction isn't that extensive in the UK, but the threat of sanctioning certainly is. So conditionality, sanctioning, work first activation that tries to drive people into any job as quickly as possible. And this is facilitated by governance mechanisms that are rooted in new public management. So what are the outcomes of that? This is my last slide on the UK in general. Well, about 10 years ago, people like me were saying, with the crisis of 08 and 09, these kind of policies will not be able to respond to high unemployment. We were wrong, as I'm quite happy to acknowledge here. Unemployment's been relatively low in the UK for a long time. We'll see how it progresses under the current crisis. But in the 10 years since 08-09 crisis, unemployment stayed pretty low. But in-work poverty has stayed pretty high. Underemployment has stayed pretty high. So there's no incentives in our activation system to deliver good quality work that people value, or good quality other social benefits that people value. Instead, you might say to some extent, the activation model fits very well in the UK with a flexible, deregulated labour market. So basically, activation functions to cycle people in and out of really poor quality and insecure work at the bottom end of the labour market. Okay, that's my, well, I've got two more depressing slides. This one is on in-work poverty, just to demonstrate the point that we've seen a steady increase in in-work poverty. There's far too much of it in the UK. I've thrown in this slide, which is a bit of a digression, but it's about the impact of the work capability assessment, which is a part of the activation offer for sick and disabled people in the UK. And the point I just really wanted to make with this slide is that when we're thinking about evaluating the impact of employability interventions, sometimes employability interventions do harm. And this is one example of employability policy, the work capability assessment, trying to incentivize sick and disabled people back into work. And this, along with lots of other evidence, demonstrates that there's a relationship between the application of that policy and poorer mental health. So when I'm going to talk about some of the positive impacts of what we think is an innovative and interesting employability program, I would urge all colleagues to look at both sides of the equation. To what extent do employability services meet the needs of service users and communities, and to what extent do they risk doing harm? Okay, apologies for the non-hopeful bit of the presentation. Let's move on to some positive stories around local services targeting lone parents, and research that myself and my team have been doing over the last few years. The concept I'm going to use, we've already fired a lot of concepts at you in terms of new public governance and the capabilities approach. I'm going to use the concept of collaborative innovation to try and frame what was going on here and why we think these services worked pretty well in supporting lone parents to find their way in a positive way in terms of their employability journey. I'll define what we mean by that in a moment. So very quickly, background to employability services for lone parents in Scotland and in the UK. Lone parents are subject under the UK model of activation to pretty much the same kind of treatment that a lot of other unemployed groups are. Quite a lot of compulsion, quite a lot of conditionality, quite a lot of rhetoric from UK government services that they will prioritise and tailor their services to single parents. Very little evidence of that personalisation and tailoring actually taking place. In terms of the services that I'm going to talk about, one thing that I would drop in here is that in the Scottish context, so the Scottish local policy context is quite interesting, because while that work first, new public management dominated approach to activation is happening at UK level in employability services, local services in Scotland are perhaps more rooted in values like co-production. If you pick up an NHS Scotland document and lots of other policy areas in Scotland, values of kind of collaboration and co-production are quite prominent. Not so much in employability services, but I just want to make the point that these ideas around collaboration and co-production are very present in the broader Scottish policy debate, even if they're not present in the way that the UK government would normally fund and deliver activation services. I'll just nip through this. Okay, so let me tell you a bit about the work that we did. A few years ago, there was a collaborative local project called Making It Work, spent about £7 million of public money, targeting lone parents, and really saying we want to help disadvantaged lone parents to progress in terms of employability in ways that they choose. So it wasn't a work first programme that was saying how many people can we get into work as quickly as possible. It was saying how can we empower single parents to make their own choices about a progression towards work and other things that they might value. So that was the objective of the programme. The funder, which was a big lottery fund in the UK, said, we think that the best way to deliver these kind of services is locally, and with the third sector, local community groups that support and or are run by lone parents, we think those third sector organisations should have a crucial co-leadership and delivery role. So they basically made that a priority. And I won't talk through all the services that were available, but the service offered key worker support and lots of other things. So again, the idea, not a standardised work first service, but lots of stuff: money advice, debt advice, access to childcare, subsidies for childcare, access to training provision, access to mental health provision. So a suite of interconnected services delivered by a broad-based partnership. Do you want to know if it worked? It worked. That was the result of our evaluation. I'm not going to talk through the outcomes from the programme. Google it if you want to know all about our cost-benefit analysis and various other aspects of how we researched this programme. What I'm going to talk about is what people told us, and that's based on more than 100 interviews that we did with stakeholders and key workers involved in delivering the programme, and more than 100 interviews with lone parents who had been part of the programme. You can read my research and our research on this. That's my one big takeaway for everyone in this session. Cite my work. I've got some big KPI pressures in terms of getting my citation rates up. I'm only kidding. But we have published lots of things on this programme. And the last couple of things that we published used the concept of collaborative innovation to try and understand what was going on and what made this a particularly effective way of empowering single parents. And basically, I'm going to summarise these two papers now. Here's a definition of collaborative innovation. Another great thing that comes from Danish colleagues, Eva Sorensen and Jakob Torfing. This is a definition that we have borrowed. And again, I'm not going to read through this, but the 2 points that you want to take away from this quotation is the idea that first, if you're trying to solve wicked problems, really difficult, challenging policy problems, collaboration, rather than, for instance, marketisation, can be a really important source of innovation. So that's point one. Point two, what do we mean by innovation in this context? Something that's disruptive, something that's new, something that says it's a radical break with, for instance, the values of the UK government's work first activation. So that's what we're looking for as a kind of output. I'll go past that very quickly. Okay, so here's three things I want to say. What we found was, in line with what our Danish colleagues, Sorensen, Torfing, lots of other people who work on collaborative innovation have also argued, is that there's stuff you can do. There's practices at the heart of this stuff that will help foster collaborative innovation. What kind of stuff? So I want to talk about three things. First, mutual and transformative learning. So build platforms where different stakeholders and service users can learn together. Secondly, take joint ownership, build a genuine partnership that drives the programme forward. And lastly, empower participation, and we also mean co-production as part of that. So very quickly, what do we mean by that? So practices for mutual and transformative learning. When we went and spoke to these stakeholders, multiple agencies, lots of partnerships working together, lots of agencies working together to build these joined up services, what we found was that they'd done a lot of work, a lot of stuff to build a shared learning experience. Co-location environments, lots of investment in virtual learning environments, shared platforms online, lots of time and space bought into the programme, designed into the programme, specifically so that different stakeholders, different agencies involved in the programme and service users could share knowledge and learn together. Lots of case meetings, lots of shadowing with different stakeholders, trying to get a better understanding of how each other practice, lots and lots of user voice, user feedback and co-production. So that's the first thing, build these shared learning environments. How was it facilitated? Because of the funding and governance model that I'm going to talk about in a little bit more detail, but basically saying a funding model that said, you don't have to establish a program at the beginning and then implement it in exactly the same way over the whole of history. You can have a lot of flexibility in your funding. So share learning, and if it's not working, do something different, co-create change within the program. So first, mutual and transformative learning, very important to positive outcomes. Second, joint ownership. Again, the idea of a governance and leadership model that was based on different stakeholders, so money advice charities, third sector organisations supporting lone parents, employability providers, training providers, mental health providers, sharing the decision-making and sharing the resources and the ownership over the programme. So not competing against each other as part of a market-based model, not being directed by the funder to do certain things, but building a consensus locally on where the resources need to go. What do lone parents actually want us to do using their voice to build and design the services? And then a lot of energy going on building a shared offer, joined up services, a one team approach. So the result was a seamless offer, and we've got lots and lots of quotes from the lone parents who worked with us saying that this felt like a joined up coherent offer that they were being provided. Lastly, empower participation. What does that mean? It means that you invest in first the kind of roles within services that support collaboration and innovation, and these key worker roles that I mentioned very briefly were very important here. So these were kind of boundary spanning roles and jobs where those individuals, those street level professionals, had a lot of autonomy and resource to connect up the different service offers to build a coherent and holistic service offer with service users. They had discretionary budgets, they had a lot of time and space to build relationships. Crucially, they had the autonomy to try stuff and stop doing stuff. That's a really important message for me, that if you devolve the leadership and you help the partnership to take ownership in collaboration with the service users, take ownership of the program, it means you can stop wasting money by doing stuff that doesn't work. So the big message in this program was, if you try stuff and then the client group are saying, we don't like it, it's not working for us, it's not achieving what we want to achieve, stop doing it and do something else instead. Solve it together. So these street level professionals and leaders had the capacity to do that. And crucially, those street level professionals and people delivering the program were challenged with co-creating and co-producing with service users. So co-production with service users, tapping the assets, the experience, the knowledge of the community and of the service user group was absolutely fundamental to this. I'll just skip through this. Yeah, I've been talking at you. Did I actually speak to any people on this piece of research here? Some nice quotations that basically hopefully capture the idea that yes, we did speak to some people and they told us these kind of experiences. So these first couple of quotations basically demonstrate, I hope, that there was a genuinely kind of joined up approach where key stakeholders were connecting up different service offers. So not a standardized offer that's trying to drive work first as cheaply as possible, but a lot of time and effort and energy to try and join up different services. This is a second quote from a key worker, basically illustrating that point that I made. If things aren't working, the message was clearly do something different, take control of the budgets, work with your service users, and be creative and innovative in how you deliver services. A couple of quotations here. The first one basically makes exactly the same point. The second one is the voice of a service user who basically, like many of the quotations that we got from service users, tells a story of co-production, tells a story of the radical break here from the kind of UK work first punitive model, which this service user was saying, actually, this is the first time that anyone actually asked me what I want. Usually what happens in a job centre is you're threatened with sanctions for not doing as you're told, and this was completely different. Again, similar quotations here, basically saying it's empowering experience from this service user. It's about finding something new, something positive. And the very last quotation here juxtaposes this experience of empowerment and co-production for service users versus what they experienced at Job Centre Plus. So a message for the public employment service in the UK and beyond would be, don't treat your service users like the scum of the earth. So co-production was very important here in building personalised services and ensuring that there was no harm in the programme. So as I would go back to my point about sometimes employment services, employability services harm people because they frustrate them or humiliate them or put them under pressure. So that didn't happen here. Instead, people had experiences of empowerment, of personalisation, strong peer support networks, supporting each other, supporting campaigns to try and build better jobs and to build better childcare facilities. I won't go into that in any more detail. Coming to the very end here, how did they do it? What kind of governance might support these really positive experiences that we largely reported in this case? Well, the first thing I would point to is that you need collaborative governance mechanisms that target the different stakeholder groups who can make a difference here. So rather than looking for a standardized model, try to do things as cheaply as possible, take the time and effort and energy to build collaboration across different groups. And that's what we found here. We found community health professionals and social workers and learning providers and childcare providers and further education providers and mental health providers collaborating and sharing the ownership of this programme. What else can we say? Yeah, the funder was very important because the funder demanded evidence of these multi-agency collaborations. The funder also demanded evidence from the partnerships that they were able to respond to the complex needs of the service user group. The funder also demanded, and all partners agreed with the idea, that third sector organisations that are run by and for single parents and are rooted in local communities should be a key player in the delivery of these services. And the last couple of lessons on governance and how to do these kind of services. One of the interesting things here was that there wasn't a lot of paperwork. Most of these partnerships, in fact, all of these partnerships, were run through relatively simple partnership agreements, relatively simple service level agreements. There was no need for a very complex payment by results mechanism and the complex governance of internal market mechanisms. You actually save yourself a lot of paperwork and a lot of bureaucracy by building collaborative approaches rather than facilitating incredibly complex market mechanisms. Okay, so I'm coming to the end. Last slide. So where do we go? Where do we go from here? I think, as you say in Ireland, I wouldn't start from here in terms of the UK model, but maybe there are opportunities. So first, the good news. Here's an example of how you can build innovative local programs that value a range of benefits and positive outcomes that service users have reason to value. So we can make better decisions in this space. Of course, there were limitations to this programme. I'm very happy to discuss them in terms of resources, access to services, and the kind of jobs that are available in local labour markets. But crucially, these services were informed by the values of co-production. You create learning spaces, you create senses of ownership, systems of ownership, you create empowerment that gives lone parents and people working with lone parents on the ground the voice and the power and the autonomy to make decisions. That was very different from the experience that single parents, lone parents had under work first activation. How to do it? Collaborative governance is the way to do it. So I'm going to end there. What can we take away from this? In the UK, where sadly Scotland is still a part of, there might be quite limited lessons for the UK activation regime, because that's still rooted in contractualism, contracting out, compulsion, conditionality, and work first. For more civilised lands like Scotland, like Ireland, like other countries, maybe the lesson here is to make positive decisions that value innovation and co-production that empower people and communities. And the very last thing I would say is that there's a great opportunity here post-COVID, because many of the jobs that are available and the way that businesses function and the way that businesses engage with disadvantaged, if we can call it that, disadvantaged groups like single parents or sick and disabled people, those business models have come under a lot of pressure. Lots more home working, lots of different ways of doing business. There's an opportunity here to sit down and have a conversation and include businesses and communities in the recalibration and the innovation of employability services. And I hope in Scotland, we take up that opportunity. I hope in Ireland, you take up that opportunity too. And thanks so much for listening.
Thank you very much, Colin. And now I will ask Flemming, Dorte and Colin to join the floor and to answer questions. We receive a lot of questions through the place that is dedicated to these questions. I will read the first question that can be answered by both teams. So in Ireland, the Department of Social Protection know they have a patchy delivery of public employment services. Do you believe that delivery of services at municipality level could be a key to successful delivery and positive outcomes? The floor is yours.
Actually, I think it's a very good question in the sense that I think that's a key question when we're discussing public employment services and how to organize them. It's exactly the questions about how should the relationship be between the central level and the local level, and what type of steering logic are you supposed to use or apply when you, as we want to have some kind of accountability on one hand, and on the other hand you need to have this kind of local ownership for services. So this is, I think that's also why we work with how to, because I think there's a lot of you need to do a lot of development. There's another question which is all about what is the, I think that's the last questions of these are about what has been the main obstacles for doing innovation into the services. And I would say, yeah, well, in Denmark, it has been definitely the state monitoring of services, this kind of performance measurement system, which is not adapted for that kind of thinking. It's very short time measurement. It's not at all adapted for looking at the you could say holistic services or a holistic approach. It's all about measuring not even outcomes, but also activities. So I think, so it's a good question, but I don't think we don't have the answers for this. But it's some research questions, and I think we'll work with this for the next years. Is how to. But I think you need to involve the local level in some way, else it's not possible.
Thank you, Flemming. I think, Dorte, you want to
Yeah, I was just going to supplement what Flemming said. I think linking to what Colin was saying about, be aware of what not to do, discover what is not good practice and change it. And I think one of the things that we've found over the years is that this mistrustful relation between the state level and the municipal level has also produced a municipal level that is used to orient themselves and build their capacity in a certain direction. And I think some of what we have done as researchers have been to point out to the practice some of these less productive ways of going about their interaction with clients, of going about their constructing new services. So sort of discovering their own practices that has been part of a huge development over a very long time and has been necessary because the way it's been governed, because the way it is governed. But sometimes it has become almost invisible for the practitioners for themselves and for the managers themselves in the local context. So discovering these problematic ways of practice is, I think, a first step to changing things locally.
Thank you.
I'll be very brief to add something, very brief. I think the answer is kind of yes, in terms of local delivery and design is obviously very effective in terms of responsiveness to local needs. There are two big things we have to worry about, I think. One is variation in capacity. I don't know what the situation is like in Ireland or Denmark, but in Scotland, local government ranges from very large cities to quite small municipalities. So we have to have protection or a flexible way of working to ensure that we can build capacity at the local level. The other thing that worries me a little bit is to go back to my very first slide that says labour markets decide to the extent to which people get jobs. And again, in Scotland, local government areas do not correspond to functioning travel to work or labour market areas. So I think that's problematic in terms of involving employers and key sectors in a solution that connects the supply side and the demand side. And also, I obviously believe that it's very important that policymakers have that in their head, that employability has a supply side and a demand side. And if we use units of analysis that undermine that understanding, it worries me.
Thank you. So I wanted to ask you to tackle these two issues, and you did it spontaneously. Great, Colin. So another question that was raised is the issue of silo funding. Do you think silo funding is an impediment to collaboration? That is, what measures what counts to them specifically, or is there something like a cultural change at funder level that would allow going beyond this silo funding? Anyone?
I'm going to go first. I was getting to my Danish colleagues, but while they formulate, I will go first. Yes, I think is the answer to that. Look, I've done a very positive, I hope, positive story around collaborative innovation. Of course, we have not to be naive, and we have to acknowledge that we're spending public money, and very often public money has an accountability structure that goes right up to a minister who has to explain to the electorate why this money has been spent in that way. So there's always going to be a component of silo funding. It's kind of up to ministers, though, or other political actors and policy actors to think about how much they are willing to absorb the risk and to explain to the electorate that actually wicked problems require collaborative solutions. And so one of the ways we can solve silo is by political leaders saying, actually, we need to collaborate on this. We need different agencies working together on this. And to take it back down to the local level, that's exactly my point from the example that I gave. The funder made a strong decision here. The funder said, the first thing the funder did was do research, and the research came back and said, this is a wicked problem that requires a joined up solution. And the funder said, we are not going to work in silos. I want to see a partnership that is multi-agency and multi-stakeholder. So if you make strong decisions as a funder, the world did not spin off its axis because this programme broke out of silos, and I think it demonstrates it can be done if you have the courage to do it.
Thank you. Yeah. Maybe a specific question for Flemming and Dorte. I'm sorry, but really time is very short. So I think it's an important question. Do you think that without a standardized approach, you can guarantee the accountability for public funds? There is concern, for example, that was raised for those people who may have better relationship with their case workers and may get preferential treatments. How does this get tackled in your model?
I actually tried to type my answer into this question and answers. So there is a written answer to this question, but it's a very good question, I think. But in Denmark, we tried to handle this by, there was a huge reform in 2016. Where the municipalities got the financial responsibility for benefits, which made them really focus on making cost-effective benefits, and that was not the same as the same type of services that was the previously. So now they work with this in a completely different way because they're actually the ones sitting on the money and having the responsibility for this. So this has made a huge change in the way, and sometimes even they become too cost effective in their way of thinking. But that's another question. And then we are back, and then the questions about caseworkers doing, giving people different type of treatment and on a different level. I think there's two things you really have to relearn now. there's two things you really have to focus on to make sure that this will not happen. Or is, for the first, you can never avoid it. It's also part of the services today. That's one thing you have to be aware of. No matter what, frontline workers, they would could be able to act differently, and they can make some kind of coping, or they can make a different way of doing things. But the best way of controlling this is to have a focus on management. So I think that this is a lack in many of these things, is that we focus not enough on the management side of this. And you need to have both managers and frontline workers to have kind of joint norms and values of how to actually cope with these dilemmas. So I think that's one part of it. And then, of course, the crucial question is the skills and qualifications of the frontline workers. We've seen, especially when we've seen this contracted out system, we've seen that the level of qualification and skills is decreasing. And I think that's very worrying if we really want to have effective and inclusive employment services.
Can I just add a little comment to that? Because I think the question takes the assumption that you can make this by standardized models, and I will challenge that very and say it won't happen either through standardized ways. And I think one of the ways we're doing it at the moment is opening up the professional practice and making, and this is also in line with Bernardo Sacca's work about, opening up the professional practice and having frontline workers and managers work together with a more open professional practice and making that enable a more equal and making sure that everybody will get a good quality service.
Thank you very much. I'm afraid we have to stop here. Thank you very much for excellent presentation and excellent discussion. And I now move the floor or leave the word to the organizers for the next sessions. Thank you very much again to Colin, Dorte, and Flemming.
Okay, great. Hi, everyone. That was an excellent discussion, some really interesting questions. I'm the person who's chairing the second session this morning. My name's Jay Wiggan. I'm a senior lecturer in social policy at the University of Edinburgh. I have a particular interest in the governance of active labour market policies, so the reform of social security and public employment services. And I've been particularly interested over the last few years in the marketisation of employment service delivery in the UK in particular, but also more recently in developments in Ireland, given that they do in many respects seem to mirror earlier developments in the UK and elsewhere. So I'm really excited this morning to be hearing about the research that Michael McGann and Mary Murphy have been engaged in on this really interesting project on collaborative approaches to public employment services and the marketisation of public employment services in Ireland. So we have two speakers this morning. First of all, we have Dr. Michael McGann, who's a research fellow in the Department of Sociology and Social Sciences Institute at Maynooth University, where he is leading a study of activation services in Ireland, looking in particular at recent marketisation reform. So I expect we'll be hearing about job path, etc. this morning. And we'll then move on after that to hear from Professor Mary Murphy, who is looking at collaborative approaches to public employment services, and who is an expert in the area of social security and active labour market policies in Ireland, and is a prolific author on these topics, and an all-round fabulous person. So without further ado, I'll cease jabbering on and pass you over to Michael for his presentation.
Thank you very much, Jay. Appreciate that introduction. I'm delighted that this session is being chaired by Jay, because Jay was one of the very first people to begin, I guess, researching or studying the marketisation of employment services in Ireland. And I've learned a lot from Jay's work in my own project and my own work with Mary. So I'm going to pick up a bit from what we've talked about this morning in Flemming and Dorte and Colin's presentations, in this idea of triple activation. So Mary and I, there's a special journal issue that we've co-edited on reflecting on 10 years of Ireland's activation turn that we're launching later this afternoon. And in that journal issue, we try to position what's been happening in Ireland as a process of a dual track approach to activation reform, where kind of conditionality, welfare conditionality policies, and the kind of introduction of a more conditional behavioral approach to being on welfare and being on benefits kind of goes hand in hand with changes in the governance of public employment services. And Flemming and Dorte mentioned Rick van Berkel's work on triple activation. I tend to also talk in kind of the related terms of thinking of PES governance reforms as kind of a process of double activation. And what I mean by that is that that new public management, marketisation, and broader kind of performance management approaches to kind of steering the frontline delivery of employment services relies on a kind of similar logic of behavioural incentives and trying to direct the agency of the people delivering employment services at the front line, just as the kind of conditional obligations that we enshrine in receiving income supports try to do in terms of job seekers, job searching behaviours, you might say. So we've obviously seen enormous reforms in Ireland over the past 10 years in the governance of public employment services, as well as in the conditions attached to payments. And critically, we've had the introduction of Intrio, we've had the introduction of Job Path, the marketised element, and obviously the local employment services network, which many of you here today will know all about these systems. So what I'm presenting today is a research that I did towards the end of last year and earlier this year, trying to understand how the kind of contracted out components of Ireland's public employment services system, the local employment services and the job path, differ in practice in terms of who's delivering the services, the kinds of approaches they're taking, and the models of activation they're enacting with people on the ground, and also the kind of attitudes and orientations that the staff have towards the clients that they're working with. And it's an attempt, if you like, to try and get inside the mystery, the black box of what happens at the frontline delivery of activation. Because we know, I come from a tradition of street level bureaucracy research, where we know that what happens in terms of policy implementation and frontline delivery is not always what's written in formal guidelines and kind of directed from above. So the approach that I'm using is some of you may remember 3 years ago, the first Leaving No One Behind conference, and I came and talked about research we had been doing in Australia on the marketisation of employment services based on survey work with frontline staff. And it's very much applying that approach, which was started by Mark Constantine in the late 90s to kind of begin to examine how governance reforms are changing frontline delivery in Australia. And I've worked with that team, and I'm taking, this is the first time that this approach has been applied in Ireland. So in July and August, I surveyed Job Path and local employment services staff. So a marketised, contracted out public employment service versus a community-based public employment services that doesn't have elements of payment by results. So what I'm going to explore now in this presentation is there any evidence that the kind of marketisation of public employment services pushed public employment services delivery in the direction of kind of what Colin was talking about, of the UK model that we shouldn't go down, of the kind of work first standardised system. So I think one of the first things we see in the differences between the Job Path and the local employment services staff are clear differences in who's actually working at the front line of these programs. So for instance, we see, 2/3 of local employment services staff are members of a trade union, whereas the Job Path workforce is entirely decollectivized, you might say. And also, we asked people about their experience of how long they've been working in the sector and also previous industries that they've come from. And you see that local employment services staff, nearly 90% of them have over 5 years experience working public employment services or in the welfare sector, and it's only about 12% of job path staff. Now, that's not surprising really at all, because job path has barely been around for 5 years. In fact, it hasn't. But it is telling us that the staff that are working in job path aren't coming from sectors that previously would have been involved in working with job seekers and working with people on welfare, that they've been recruited from quite different sectors of the economy. And we see that in data we have about the previous industries that people worked in before working in public employment services. Blue is the job path staff, and kind of orange figure here, or strawberry blonde, you might say, is the local employment services staff. And just to highlight, I mean, I think the key differences here, we see about a quarter of the job path frontline staff come from the kind of hospitality and trade section, or sectors, or financial, and then again a further 17% from financial insurance activities, sectors of the economy that very few local employment services staff come from. Whereas on the other hand, local employment services staff are more likely to come from kind of an educational background, or a health and social work background, or maybe have previously worked in kind of an administrative support activities, perhaps as clerical officers in force, and so forth. So they are quite different workforces in terms of kind of their level of experience, in terms of their kind of professional experience, and so forth. And that also comes through very clearly in the kind of age and qualification profiles of the two staffs. So what we see with job path base is about 2/3 of the job path staff are under 45 years of age. So predominantly job path staff have kind of secondary education, or a non-degree third level qualification as their highest level of qualification. But that's almost flipped with the local employment services staff, where 2/3 of them have at least a university degree or higher. And in fact, it's as 80% of the local employment services staff are over 45 years of age. So it's an older, more highly educated workforce than the job path workforce. And of course, that's connected to the kind of contracting regimes, delivering programs, and the importance of keeping costs low in order to win contract tenders. But I also want to bring in what this looks like in comparison to the UK. And certainly, if you compare the kind of frontline employment service staff in Ireland to the UK, they are, and including job path, they are tend to be higher skilled, more highly educated than similar staff in the UK. Although this would also suggest that in the case of job path staff, they would actually tend to be younger than the equivalents delivering the work program in the UK. But I do want to emphasize that point, that they do tend to come from more highly skilled, qualified backgrounds in comparison to what we've seen in a kind of marketized system in the UK. And next, I want to just explore some of the findings we have about how they kind of manage what we might say is the kind of caseload management, the number of clients that they're dealing with, how many clients they see on a daily basis, the kind of things that people are spending their time on. We don't actually see major differences in terms of caseload sizes between job path and local employment services staff. And some of this is potentially COVID related. The pandemic's obviously had an enormous impact on referrals, where we do see big differences in terms of the number of job seekers that people are meeting with each day. So on average, job path advisors are telling us that they see 12 clients per day versus local employment services staff who see 7 clients per day. And I also did follow-up interviews of people who participated in the survey, and I found from those interviews that generally job path advisors will see clients every 2 weeks or so, and often more frequently for sort of group training workshops, whereas in the local employment services staff, the frequency of appointments tends to be pretty much monthly, and occasionally they might bring certain groups of job seekers or clients in for more regular appointments than others. But so, in other words, job path advisors are seeing clients more frequently for shorter durations, whereas the local employment services are seeing clients less frequently, but perhaps for longer appointments. And that's because they both tell us that they're spending about the same amount of time in direct contact with clients. There's very little differences in terms of kind of the activities that job path and local employment services staff are spending their time on. Predominantly, it's in direct contact with clients. This working with employers is quite similar. Working with others, these are really social services providers, is a little bit of a difference. The proportion of time that job path spend on that is about 6% on average, compared with 13% across the local employment services staff. But what I want to draw your attention to is the significant amount of time that both JobPath and local employment services staff spend on just contract compliance to meet government reporting and admin requirements. And this comes to the accountability issues that we were talking about in the previous session, and the burden that this imposes on frontline staff. And there was a perception among, especially the local employment services staff who've been really influenced by the introduction of the BOMI system, that this accountability focus was getting in the way of actually being able to spend time on delivering personalized support to job seekers. Some of you may remember this image from the early 90s of a Tamagotchi, and one local employment services mediator described to me, the accountability now is more important than actually the production of an outcome. The whole administration of seeing people, recording stuff on BOMI, all of this is detracting them from what are we doing to get people off the dole. It's like feed the Tamagotchi and forget about the core reason why we are there. So this sense that reporting and feeding computerized case management systems and so forth, information so that the work that they're doing on the front line can be seen to be in compliance with the Department of Social Protection's contract, and that they're adhering to the relations of to the requirements of the contract, is taking a huge amount of time and focus away from the actual frontline delivery of employment services. And that's across both JobPath and the local employment services. But we do see differences in what you might say is the kind of accountability regimes that the two workforces work under. And this comes to Rick van Berkel's idea of triple activation, where basically how the government purchaser is managing the contracted providers then filters down in terms of how those contracted providers manage their own employees and their own staff, in terms of things being built into internal employee appraisal systems and performance targets. And what we see very clearly is that the payment by results model of the JobPath contract is reflected in a much greater performance orientation amongst its staff. So for instance, I do take note of those actions with clients that will generate a payable outcome or reach a target with clients. You know, it's 60% of JobPath staff are agreeing with that. Obviously, it's half the number for local employment services. This isn't surprising because, again, local employment services staff aren't paid by results. I'm aware that my organization pays attention to the outcome I generate by placing clients. It's 80% of JobPath staff that agree with that. Just 10% of local employment services staff. So there's much more awareness among the JobPath staff of, you might say, the kind of commodity status or the commodity implications of their interactions with job seekers and with clients. Are they influenced by these numerical targets in their role? And it seems so. 50% or more of JobPath staff disagree that they're not influenced by numerical targets. In other words, they are very much influenced by numerical targets in their role. But I think what's also really interesting is this question about, to what extent does their supervisor know a lot about the work that they do day to day? And this is like the extent of kind of managerial oversight or supervisory oversight of staff. And it's 86% of JobPath staff agreeing that their supervisor knows a lot about the work that they do day to day. 75% of local employment services staff reporting similarly, but the proportion that strongly agree is double amongst JobPath staff. So it's suggesting perhaps a more intense level of supervisory oversight of JobPath staff than is the case in local employment services staff. And perhaps that's connected to the kind of professional backgrounds and qualification levels of the two workforces. But what are the things that are influencing the decisions that they're actually making with clients? What are the kind of influences on their decision making with clients? And what I'm trying to do here is basically think of a trinity of kind of considerations. Is it their own professional frontline discretion? Is it an emphasis on giving job seekers choice about the services that they receive? Or is it adhering to standard policy rules and guidelines and program guidelines? We see very little differences in terms of the reported use of frontline discretion by the two staff. My own judgment is quite very influential on decisions. Use a lot of personal judgment to decide what's best for clients. Very similar across the two programs. Agencies emphasize giving clients a lot of choice. Very high across both frontline workforces. Where we do start to see significant differences is in the extent to which frontline staff are telling us that government activation policy is influential on the kind of decisions that they make with clients. It's not particularly high, but it is slightly higher among job path staff. And again, standard assessment questions, are they very influential on their decision making with clients, or standard program rules and regulations? That again would appear to be higher on the decision making of job path staff. But again, to bring in the UK perspective, far less so than would be the case in the UK. Well, and if we look at job seeker choice, that's much higher in Ireland in terms of influence on decision making with clients than we would see in the UK. I should say though, the caveat is this is obviously frontline workers' perspectives, and whether job seekers actually feel that they have a significant level of choice or autonomy over the kind of services that they receive is another question. But what I also want to explore is this kind of work first element. Is there evidence that there's a kind of difference in the two approaches, one being more work first oriented and one perhaps being more kind of oriented towards education or training or human capital development, as Colin Lindsay might talk about it. And yes, we do see significant differences here. So kind of the red codes for an emphasis on work first. Based on the practices in your office today, what would you say is the most important goal of your agency? Get jobs as quickly as possible, or raise education and skill levels. So we can see amongst job path staff that there's a greater emphasis compared with the local employment services staff on getting people into jobs as quickly as possible, but but there is still a significant emphasis on raising educational skill levels, and we see that more so though in the local employment services staff. And again, if we bring in the UK perspective, we see that Ireland, at least in the view of the frontline staff, is less work first orientated than the UK, even though we might say the job path is more work first orientated than the UK. And again, there's kind of another way we explore this question. If there's an item in the survey about someone's attending their service, they're offered a low skill, low paying job. So it's kind of priming them for this kind of consideration of work first, rapid labor market attachment. What would you advise them? Stay on benefits, wait for a better opportunity, perhaps through education or skills or reskilling, or take the job and leave welfare? And again, a much higher, okay, I'll wrap up, a higher inclination towards taking the job and leaving welfare among job path staff than among local employment services staff, although it's fair to say that both of them are quite work first orientated in this scenario, but again, not compared to the UK. And then just very lastly, I'm interested in exploring what are the differences we see in kind of how the frontline staff understand the reasons why people are on welfare, the reasons why they're on benefits. And so what you might say is perceptions of clients' deservingness of, in terms of how deserving people are in terms of being treated generously, receiving welfare payments. And one way we try and explore this is we ask this question about which is more often to blame if a person is on benefits, lack of effort on their part or circumstances beyond their control, pushing it towards do people kind of think of unemployment as a kind of individualistic behavioral problem, or do they see it in more kind of structural terms? Again, there's evidence here about that job path staff are slightly more orientated towards this kind of individualistic behavioral understanding compared with local employment services staff. But again, to bring in the UK perspective, not as high as we see in the UK. I'll skip over that. It is connected to differences in union membership and solidarity. And then lastly, should there be more government spending on benefits for unemployed people than now, which is kind of another way of getting at this issue of deservingness. Local employment services staff much more inclined to agree with that statement than job path staff, but that is also connected to an awareness, and this came out of the interviews among job path staff, of what you might think is benefit traps. That's connected to also the low paid nature of employment that's available kind of in the periphery of the labour market, and the fact that people will be giving up perhaps access to medical card or housing assistance payments and so forth if they move from welfare into work, and that can be a barrier to that transition. So very quickly to sum up, what we see is, yes, there are significant differences between local employment services staff and job path staff in terms of staff profile, age, qualifications, experience, unionization, and so forth. There's more of a performance accountability element connected to this idea of triple activation among job path staff. We do see elements of a distinction between a work first and a human capital orientated approach between the two programs, and elements of distinct attitudes towards welfare and unemployment between the two programs. But, and I do want to emphasize this point, that for now, the differences between kind of marketised and non-marketised delivery in Ireland, we also need to take into consideration that there are still very significant differences between the marketised delivery in Ireland compared with the marketised delivery in the UK in terms of Ireland seems less rule-bound an approach, less work first, with more of an emphasis on job seeker choice and what you might say a softer attitudes towards claimants. Whether that will persist as we go further along the marketisation trajectory or pathway is something that only time will tell. So I'll leave it there. There is a much larger report behind this, which you can download at that website below, and I'll stop sharing now.
Hi everybody, Mary Murphy's the name, and thank you for the kind introduction, Jay, and thank you, Michael, for all your work. And I must say, Michael being with us on this team has made an incredible difference over the time that we've spent together and really lifted our work. And you can see just the tangibility of the type of data that he's producing, that we now have much more fine-tuned evidence in terms of understanding what the impact of recent changes have been. So in terms of takeaways, what I wanted to look at in today's presentation very quickly is the idea of an inclusive public employment service, one for everybody. What are the challenges within that? Making the argument that we will see fairly significant further disruption of labour markets in the future in connection with automation, digitalisation and climate change. And what do we need to do to prepare for that? And I want to review a little bit the institutional and governance changes since the last crisis and the impact that they have had on people. And then maybe looking back to that issue of centralisation versus localisation, the challenges there are, particularly in Ireland, of achieving local integrated service delivery in a highly centralised state and what that means for integrated delivery. And then I want to move on to point towards, if we do want to move to a more hopeful vision maybe of employment supports, what might that look like in the future, and encouraging us to use our imagination to think of a new architecture of what public employment services might be like. And I just want to say, just from the outset, you know, the OECD just this week published a report on the importance of public employment services in the context of COVID-19 and argued about public employment services needing to be scaled up. But they also argued about the need for stakeholder engagement, the importance of the organisational setup of employment service, the need to be flexible and to be prepared for crisis. So we're very much on the spot, I think, in terms of bringing these things to your attention. And I'm quite pleased about the relevance and timeliness of what we have to present to you today. So just in terms of the first challenge that I think we have is the sheer scale of what public employment services ideally need to be doing if they were to be inclusive and available to everybody who might need it. Even on the narrowest version of everybody on the labour force who is presently on income support, including people on the pandemic unemployment payment, we see that really about 880,000 out of 1.6 million in the labour force are on income support. So there's a massive challenge there. But I think our point has always been right from the start that we need to think of everybody who is potentially wanting at some stage in their lives to engage in employment. They are the target for public employment services. We need also to think of all workers as potentially needing public employment services, as they may need to graduate out of university, for example, and into jobs, or in the context of just transition and climate change, as NESC show, they will need support in reimagining their own working careers. So 1.45 million are on income support in March 21 out of a total working age population of nearly 4 million people. So if we're thinking about the scale of what we really need in public employment supports and to match that with what the population might need for whatever reason, at whatever stage of their life course, in whatever stage of labour market transition they may find themselves in, we see that we are very out of kilter with what might be really needed in terms of public employment supports. And that worries us. And I must say, as a university lecturer, seeing our own graduates go out into the labour force now, it worries me particularly because I know that many of them don't know where to go for good advice and support. just to give an example of that, and I call these the invisible women, but qualified adults, we find 70,000 qualified adults, primarily women, are on some sort of working age family-based income support, be that an employment support, a disability support, or a job seeker one. So there are a very significant number of women out there in particular who don't get captured by public employment services and who need to be. Now, I mentioned the complexities of the changing world of work. If we think of digitalization, if we think of automation, if we think of climate transition, and it seems to me that we need to think much more imaginatively about what this might mean in people's lives. Right now, we have the idea of flexicurity, that people need good, solid social security and public services to enable them to be active and flexible in the context of a flexible labour market. But we know that many people actually experience flex insecurity. They certainly experience a flexible labour market, but they don't experience the security of good social security and public services. So their lives are very precarious. But we need in the future to think about much more about what a sustainable welfare system needs to enable people to do in the context of not only managing their own life transitions, but also being the kind of ecological citizens that will have the time and energy in their own lives to live sustainable lives moving into the future. And that means reimagining work. It means reimagining our role as consumers and our role as carers, both of each other and of the planet. So we need to think outside the box a lot in relation to all of this. As we know, we've had very significant institutional change over the last decade, and we've moved in February 2010. We had a public employment service that was primarily made of FÁS and the local employment service network. And it was an inclusive national public employment service that was open to all, while the LESN was more targeted. One was government funded, one was grant funded. There was no marketisation as we know it today. We've changed now in the public employment service in February 2020 to Intro, which is internally funded, Employability, which is grant funded, the LESNs and job clubs, which are grant funded, and Job Path, which is marketised with pay by results. And we know that that system is under significant reconstruction and change right now with new types of tendering out as we speak. The biggest change may be in relation to marketisation when we look at it first, but personally, I think the biggest change is in the degree to which PES services, public employment services, are now extremely targeted on the welfare population and aren't available to the wider set of workers and non-workers in Ireland right now. I actually think that's a bigger underlying change that we need to be more mindful of as we move forward. All of that change has had very significant impact on the relationships in this field of public employment services. So as part of the research we did, we used a strategic action field framework to think about how the underlying structural rules of the game changing in the context of governance and marketisation and institutional reforms, how that impacts on the agency and the dynamic interaction between all the different actors in the field. We're mindful in that Ireland is a very small market, it's a small state. So the introduction of marketisation is going to be different in Ireland, probably, and create other types of dynamics than we might understand marketisation in larger states. And we can see that there are incumbents like the Department of Social Protection or Intro, who have a lot of central actors in the game involved in governance. And then we have challengers. We have organisations like the Local Employment Service. We have new challengers coming in like Job Path and new actors. And the dynamic that all creates is one of turbulence, is one of tension. And we also have adjacent action fields that are also in the formation stages. We've had SICAP, and we've had the reformation of the education training boards and SOLAS. So we've had a lot of change and turbulence institutionally in the overall area. And that may have shifted some of what we've previously understood as collaboration and cooperation into a new environment of competition. So we don't get collaboration, or we get more a thing like co-opetition, where people are still collaborating, but maybe they've one hand tied behind their back, wondering, will they be competing against this organisation for funding at some stage? So a lot of dynamic, a lot of nervousness, a lot of tension in the field. And I know even some people watching this presentation now are quite stressed with the immediate changes that are going on. So I just want to acknowledge that. So what we have argued is that in the context of trying to think of a quality approach, a high road approach to an inclusive pandemic recovery, that we need to move away from a narrow version of public employment services solely for people who are targeted because they are a burden on the state in terms of welfare, or because we want to enable them to move on with their lives, moving from welfare into work. We need to think about the future challenges in terms of automation, digitalization and climate change, and understand that all of us are likely to be reimagining our worlds of work at some stage in our life transition. And we need a range of institutions that allow everybody access the guidance, the employability guidance, the career guidance, and other forms of life navigational guidance that they will need in order to make those shifts. We've looked at the present combination of institutions, and we see that there are gaps in terms of culture, in terms of capacity, in terms of competence, in terms of the nature of the contractualization model we use, but particularly also in terms of care, the ability to bring care into the public employment services agenda, both in the kind of non-stigmatized caring relationships we'd like to see in frontline service delivery, but also care in terms of policy, enabling more inclusive forms of work, enabling better work-life balance, enabling part-time work be a valid choice for people. So our sense is that if we were really thinking about a big inclusive welfare system that had at its core public employment services, that it would be also opening them to much more actors. And we would need to think about a public employment ecosystem that would involve not only the Department of Social Protection and Intro, not only the contracted services that they have at the moment, but the much wider range of actors, both in the private sector and in the public and voluntary sectors, that are engaged much more broadly in this field, and that we would need much more collaboration, networking and integration of policy across that whole sphere, as we've tried to outline in this diagram here. Now, there was a question already about integrated delivery in the context of local municipals, and I think this is particularly challenging for Ireland. We do need interagency, multi-agency joined up thinking, and Ireland is an extremely centralised state, probably the most centralised state. We can see from this chart here, looking at the local autonomy index across European states, that Ireland has the lowest level of local autonomy in relation to the whole set of countries. Now, the UK doesn't have a lot either, but we can see in countries like Denmark, who are at the other end of that scale, that there's much more that you can do in terms of interagency when you have local government that is much more autonomous. So Ireland is particularly weak here, and in a comparative assessment, we're usually lumped in with countries that have very strong centralised government and very weak local autonomy. And that really presents challenges for our capacity to deliver integrated services. And we're not the only ones to look at this. The OECD has looked at it, NESC has recently looked at it, the SRI looked at it in the context of a recent CICAP evaluation. But bearing that in mind then, I think the degree to which we can do network governance through our local government is weak, and therefore we need to think of other ways about giving a chance for integrated local delivery. And we were actually very good at this in the mid-1990s. We set up local area-based partnerships, partly in response to the weak local infrastructure. And part of the work that we've been trying to do recently, and we were interrupted with this a lot in relation to the pandemic, because we couldn't track interagency collaboration at a local level during the pandemic, but we now have the data in, and we've been able to track across a number of local agencies what type of local interagency work they are really doing, whether it's work at an individual level with people, or whether it's structural work trying to address local issues in relation to the local market, or other types of local services that people might be trying. So we'll have a much better sense soon of the type of integrated service delivery and what it's oriented towards, and we'll be publishing that soon. So just wanted to leave you then with the idea of needing a new sustainable type of welfare architecture, one that's thinking ahead to the challenges that we're going to see in the next decades, and that's about enabling everybody to participate, not only in the economy, but also in their society and in their ecology, I would add. And our sense is that we need to think differently about income support when we're thinking about this. So we need to think outside the box about how our social security system is not just used in a conditional sense to push people into the paid labour market, but how it can also be used to enable people to maximise their social participation, either in itself as a valuable goal or as a transition into paid employment. And this is something we've actually done quite well in Ireland in some respects. If you think about it, we have used qualified adult payments, lone parent payments, carers allowance, social welfare payments as a way of enabling people to support the care role in their lives. So we have an idea of how we might do this. Participation income has been offered by Atkinson as a halfway house between what we presently understand the role of social security to be and something like basic income, a quite utopian idea of how income support might work. A participation income allows you to think of the social welfare payment as a key tool that can target enabling people to participate in society and in maximising their own capacity to live life. It can be associated with trying to enable people into paid employment, but it's wider than that. And we would argue that if we look at things like the Netherlands Participation Act, or even some of what you've been introduced to by Colin and Flemming and Dorte earlier on, there are elements of enabling people and encouraging them to look very wide at what we understand as participation, to enable them to really maximise their short-term and their long-term goals in life. The artist's income idea coming out of the pandemic in Ireland is similar to this idea. Some of what's happening in common agricultural policy subsidies is similar. We have ideas in the programme for government of pilots for basic income. The NESC report is encouraging the pilot of a participation income. So we feel that there's a lot could be done in this space to advance our use of all the tools that are available to us to maximise people's participation. Likely, we have active labour market measures, and traditionally in Ireland, we have tried to orientate them around supporting people into employment, but we're also used to the idea that they would support social goals, like the original social employment scheme or community employment at the moment, like TUS and the rural social scheme at the moment. In other countries, in France, Italy, Germany, Belgium, there are also examples of active labour market measures being used as broadly as much more broadly than simply pushing people back into paid employment, but used to really enable other social goals be met alongside the goal of eventual labour market participation. And Jay Wiggan, who's chairing this session, has pointed out that Ireland has quite innovative practice in some respects in relation to the use of active labour market measures for more social democratic goals than maybe simply work first goals. And I think that's important. So I want to leave you with that idea of the need to reimagine welfare and public employment services in a wider agenda of preparing for a different world that will be turbulent, that will be full of life transitions, and where we will all need to do different things in our lives to meet the the challenges of climate change, but also to live more flourishing lives. And the type of lives that some of us saw lessons in the pandemic, where we saw ourselves wanting to be different community actors, family actors, care actors, democratic actors, and ecological actors. So I think our challenge is to think outside the box and to think ahead and see what might happen. So I leave you with that challenge. Thank
you. Thank you very much, Mary. That was an excellent and fascinating presentation, wide-ranging and detailed in equal measure. We've had some really interesting feedback and questions from participants in the audience. So I'll try and summarize some of these and pass them on for yourself and Michael to respond to. I guess we finished on quite a broad forward-looking vision there at the end. And a few of the questions that have been posed by members of the audience relate, I guess, to the broader ecosystem of employment and employability services in Ireland. So we've had a few questions around about the relevance of, for example, the employability service and where, for example, ETB, adult education guidance services, and job clubs sit within the framework, I guess, of service delivery in Ireland and what they can have to offer And I think Michael's engaged partly with some of these issues on the chat regarding job clubs, but it might be useful to kind of reiterate that verbally as well. So, yeah, I mean, if I pass over to you for that.
Sure. Yeah, no, it's a very good point. And I didn't mean to give the kind of misleading impression that the PES system was essentially job path and local employment services staff. I guess the reason for that particular focus was effectively there are two end-to-end case management programs focused on a very similar cohort of clients, people on the live register who are long-term unemployed or at risk of long-term unemployed. They're both year-long programs. So they allow a comparison between them in the way that a program like Jobs Club or Employability don't, because they're focused on very different, the nature of the services are quite different and they're focused on very different cohorts of people. But that's absolutely not to disregard the importance of those programs at all. And as Mary's talked about after, we are very much thinking of moving towards a much more ecosystem approach, recognizing that different types of activation programs delivered by different types of providers are, and under different kinds of contract conditions and commissioning relationships, have a role to play in a broader ecosystem approach that can bring in a much larger cohort of the population in terms of supporting their employability and participation in the labour force. Although we would also make the point that participation needs to not just be about paid employment, but social and democratic participation as well, which Mary talks about too. And I should say that, like, with this discussion of work first, it's not to say that work first doesn't work for some people and doesn't have a role to play at all in kind of any public employment ecosystem or active labour market policy approach. It does, but it's just whether you want a work first model of activation for all cohorts and recognizing who are the cohorts that are potentially left behind by work first model and who are the cohorts that kind of approach would suit, and whether we're in focusing it on the long-term unemployed, whether that's a wise decision or not. I'll let Mary do you want to come in and add on that?
Yeah. I mean, first of all, just to plug this afternoon's session, because some of this comes up very relevantly in Nuala Whelan's presentation on an enabling model of employment guidance, which does try to stretch out the concept of employability to a wider kind of concept of social participation and a spectrum into work first. So it's not, I think, as Michael was saying, it's not that we would need everything that we have at the moment and more. So it's not an argument against anything. It's an argument for filling the gaps, and an argument that there are a very significant number of gaps from the point of view of just numerical capacity, but also from the point of view of making sure that we have the services that are most appropriate for those who are most left behind in the labour market. So I think in terms of being hopeful, and I think I'd like to thank Jay for some of his contributions and some of his writing about that, because he sees Ireland from a more bird's eye view, and he has brought to our attention the degree to which there are still some very positive aspects to Irish policy that are there, and maybe we're so used to them we don't see them. But even things like community employment schemes and things like that actually have a lot of social participation goals embedded in them, and they are being pushed more towards employability goals at the moment. But I do think things like the employability service, job clubs, the education and training board services, we actually have a lot of very good innovative creative practice at the moment that is quite flexible about the pathways back into paid employment. And I think it's about building on some of what we have, but we need an overall framework, and we're offering the ecosystem idea as an overall framework to embed that in terms of the being accountable about that. There's been recent work done on a metric to measure distance from the labour market and distance travelled. Nuala Whelan is doing more work on that. So I think you can develop metrics that don't just score the employment outcome as the end outcome, but that capture what people are doing to either make social contributions or make increases in their own distance travelled over time. And it's about where we want to settle on that spectrum of activity. There was a question there, just to answer it, about the report that was commissioned by the DSP for the purposes of feeding into the development of public employment services and contracting. And our understanding is that that report is to be published at some stage. We haven't seen it ourselves yet.
Okay, thank you both. another question that has arisen, I guess it touches on this issue of participants in the programs. Michael, obviously you looked at speaking to people who are delivering services. So we've had a question about the extent to which whether you've engaged with people who are using these services, or whether you're aware of any kind of research into their experience of using, say, the local employment service compared to JobPath. I wonder if you'd be able to say anything about that.
Certainly, yeah, that is part of the research that I'm actually currently doing. So I'm currently in the process of interviewing participants and job seekers about their experiences of public employment services, not just the local employment services and JobPath, but also Intrio. And I suppose that's another piece of the picture that I would want to keep in the puzzle too, is that how what's happening at the front line of the Intrio service as well. And that's an area that I also plan on doing further research into as well. So my work is still ongoing. There's several months left to go on this particular project that will include further research on frontline delivery, but also, as you were talking about there, and that question, very important question, claimants and job seekers' experiences. I should say that there have been colleagues in Ireland, particularly our colleagues at WIT in Waterford, and also University College Cork, Tom Boland, Ray Griffin, and I think Fiona Duclos and some of her students have done some work in this area as well. So there have been some very interesting kind of sociological studies of job seekers' experiences of kind of activation, and the double activation term that Mary and I talk about in the journal issue. Less so from this kind of comparative perspective that I'm trying to approach it, in terms of understanding how the differences in the types of services delivered by different providers. But so it is a piece of ongoing work. So I can't report on anything at the moment, but it will be coming down the track.
Okay, thanks. In your presentation, one of the I found really interesting was the difference in the kind of educational attainment and the kind of occupational background of advisors in the different services. And someone has asked whether the kind of the prevalence of the sort of retail sales background amongst staff within JobPath is related to the kind of standardization of the service, and whether this is kind of a Salesforce driven system, I guess, treating labor almost as, you know, literally a commodity. And so you hire people with expertise in selling commodities.
Good question. I don't know the extent to which that's yet the case in Ireland. I would certainly say we would certainly see that in Australia and the UK, where we've done this related research before. I think one of the other pieces in that difference in the kind of qualification levels is there has been a kind of long-standing relationship between the FOSS, the old FOSS, and the local employment services, and kind of continuing professional development in guidance training, and Nuala later today we'll talk about some of that. And so in the kind of interview research, when I followed up with people, it was clear that a lot of the local employment services staff, the reasons why they had high-level qualifications is that they had undertaken kind of guidance training or kind of counselling training through programs like offered by, for instance, Maynooth University's Department of Adult Education, and FOSS were kind of instrumental in putting that program together in the early 2000s, I believe, and that's sort of been a legacy of that practice that's continued. And then from that, they've gone on and done further master's degrees or postgraduate degrees, certainly people that I spoke with as well. So that's kind of been a legacy of the kind of approach that Ireland had in the late 90s and early 2000s in terms of thinking of a more, you might say, human capital orientated kind of approach. That's still with us today, and I think that's also partly driving that consideration. I mean, one of the other things to say is with the JobPath contracts, there were social clauses built into them as well, and that's certainly one of the things that I found in the interviews, where a lot of, not necessarily a lot, but significant numbers of the advisors were themselves people who had previously been on welfare and been unemployed and been made redundant during the recession. So for instance, like 3 out of the 10 JobPath advisors that I would have interviewed would have been in that perspective as well.
Okay, thanks very much. One question I had with respect to this issue of accountability, you talk, obviously the contractual relationships are incredibly important, and your kind of survey says that. But and I guess this is to yourself and to Mary, really. Is market accountability now almost entirely dominant? Has that kind of displaced any kind of sense of democratic accountability through the political process, or are politicians still actively engaged with what's going on in the public employment system?
I mean, there are some politicians on at this conference today, so yes, they are still engaged. I mean, I think it's been difficult over the last 18 months to gauge a normal type of answer to something like that. We can see a contracting creep for sure in terms of it becoming the much more dominant way of thinking. But I think it's important, and one of the reasons that we wanted to invite the examples from Denmark and Scotland to frame and to start the conference earlier today is to insist that even in the context of procurement or contracting, and even in the context of EU membership, which Scotland was, these things are possible. It is possible still to be creative, to think about networked governance, to think about collaboration, and that you can build accountability in contracting terms. You can be creative, you can identify metrics that allow you to seek the actors that you want to give contracts to that will deliver that type of dynamic at a local level and that will deliver non-stigmatized services. You can metricize some of that. So even in the context of it being the standard discourse, I think there's still a lot that can be done to build in some of the visions that we've been talking about into it. And the challenge is to the democratic actors to ensure that that's been done in relation to the use of public funding.
Do you have anything to add on that, Michael?
No, I think Mary's summed it up very well. I mean, I suppose the other thing would be EU procurement law has had an enormous impact in Ireland as well. So there is also a sense as well about some of this being driven outside, as well as perhaps certain positions within the public service being kind of inclined towards going down this path in the first place. But there is a kind of wider political context around the Troika and European procurement law as well that has also had an influence on the kind of what the department might feel as its capacity to avoid some of the kind of payment by results kind of procurement programs.
Okay, well, I'm conscious of the time. I don't want us to run over too much. Thank you very much to Mary and to Michael. Do either of you have any final comments you'd like to make?
No, just to encourage, because some of what people were asking about the lived experience of this and the perspective of the claimant in, that some of the papers in the special edition that we're launching at the 3 o'clock session do directly capture the experience of claimants and their views on welfare conditionality and the services that they're getting. So just to encourage people to come back for the afternoon, because I think you will find it genuinely informative and useful. Yeah.
Okay, great. So tune in later for more excellent information. Okay.
Thank you.
Thanks very much, everyone.
Thank you, Jay.
And I guess we'll see you this afternoon.